Dr. Covington from Abundant Health and Vitality Associates in Charlotte, North Carolina. I have been asked to talk about bariatric surgery, and I do have a video where I've talked to one of my previous patients about vertical sleeve gastrectomy. She lost 175 pounds. Make sure that you do check that video out. It'll be below in the description. In that video, we talked about her experience of losing weight, what all improved for her, and we were very transparent and honest, and she talked about how she regained weight. I am not a bariatric surgeon, so why would I see someone who had bariatric surgery? It's because of her weight regain. So she lost the weight that she gained again, and she did that in our clinic through medical weight loss. So let's talk about bariatric surgery. So the first question that I was asked are, what are the 4 types of bariatric surgery? And again, let me preface it with this. What do? I'm a bariatrician, so I am a non-surgical medical weight loss specialist, or some parts of the country may call us obesity specialists. So I do not do surgery. Have I been in practices with surgeons or worked alongside bariatric surgeons? Of course, yes. Have I seen bariatric surgeries performed? Yes. Have I been in the operating room? Yes. Am I knowledgeable? Yes, but I am not a surgeon. So the best person to do a consultation and to answer detailed questions is going to be my colleagues. I say that we're cousins, the bariatric surgeons. But I will tell you what I know, and I will tell you the counseling that typically happens when I see a patient who is inquiring about surgery, whether it's right for them or if I refer someone to a bariatric surgeon, which I do often. So what are the 4 types of bariatric surgery? Lap band. So that's a band around the portion of the stomach to reduce the amount of food that goes in and helps with fullness. I will tell you what I know about lap bands, that it is not done as much now as it was several years ago, probably before like 5 to 7 years ago. And that's due to the reflux, ulceration, and just different complications, nausea, vomiting, with that band being too tight. But one of the caveats for that was that it was not permanent. The band could be taken off. That was one of the pros. And the other pro was that people did lose weight with it and that it could be tightened. But it's not a surgery that we typically see anymore. It depends on which part of the country you're on, which surgeon, but at least in Charlotte, it's not a surgery that I often see. Do I see patients who still have a lap band and just left it in place? Yes. Can people gain weight that they have lost with lap band? Absolutely. And I'm going to talk about how people typically gain weight after bariatric surgery at the end of this video as well. So that's 1. 2 is a duodenal switch, and this is not a common surgery. It's probably one that most of you have never even heard of. It does typically yield the most weight loss, so 80 to 90% of individuals will lose at least 50% of their excess body weight. And it is more in depth, and it involves more cutting surgery than the gastric bypass and vertical sleeve gastrectomy, but it's also not done as commonly. If I'm not mistaken, that might be due to how complex it is, increased risk as well, and also because we have better bariatric surgery options. But that is one that is still done, but just not as popular. 3rd would be the gastric bypass, or Roux-en-Y, or some people may say R-N-Y. All of those are all the same. That is one of the most common bariatric surgeries that are performed in the United States, where a portion of the stomach and intestines are taken and rerouted, and that surgery helps with reducing food intake, helping with satiety and fullness. And for the gastric bypass, as well as the vertical sleeve gastrectomy, which I'm going to talk about in just a second, there's a large portion of the hunger hormone that is taken out as well, or the receptors in the stomach that secrete hunger hormone. So not only are they restricted, people eat less, but they're physiologically less hungry as well. So they have less hunger cravings, and they have less of a drive to eat. So that is the gastric bypass, and then there's a vertical sleeve gastrectomy, or VSG, which is the most commonly performed performed bariatric surgery procedure in the United States. So with VSG, what happens, the stomach is cut about 80% off, and there's like a little banana shape that is left. If we have an opportunity, we will insert a picture of that just to make this more clear. And those individuals also have restriction for the amount of food intake, and it takes less food for the stretch of the stomach, so they have more satiety with less food. What are the pros of bariatric surgery? Well, the huge pro is that we see a lot of diseases go away. We see the same thing with medical weight loss as well. We see diabetes go away. We see sleep apnea, hypertension, high cholesterol, the 200 plus diseases that are associated with excess weight. A lot of those get better. We see people's quality of life improve. We see people have more energy, be able to move around more. So we see medically things improve, and that is why we offer these types of solutions, is because ultimately we want people to get better. Other things that are pros, most of the surgeries are non-invasive, so a lot of them are done laparoscopically. A couple holes that are poked in the stomach and tools that are used, versus having to open people up like they had to the first couple waves of these surgeries. So for the most part, they're pretty safe. The death rate or complication rate from surgery is less than 0.1%, or at least the last percentages that I've seen quoted. So they're pretty safe for, low risk for a very high reward. So that's a huge pro. What are some of the cons? Well, these are life-altering surgeries. Then once the stomach is cut off, it's not coming back. So it's something that people have to be very committed to, but that can also be a pro. It's a huge commitment. Whereas telling somebody to change their diet or exercise does not require as much commitment, and that's probably why people have much more success with bariatric surgery versus dieting. So that is a fact. Bariatric surgery and medical weight loss have been proven, and it is evidence-based that the weight loss is more in terms of the numbers, and also more likely to stay off with those types of tools and resources versus nutrition, exercise when someone does it on their own. The tools are just stronger. So it's a bigger commitment, which is one of the pros as well. Some of the cons, well, these patients need to make sure that they get enough protein, so they don't have thinning hair or hair falling out. They can lose weight very rapidly. That can cause some loose skin. For some people, that's very debilitating. I've actually had patients who did not want to continue with weight loss because they hated the loose skin so much. Sometimes that skin can cause some rubbing, friction, and some issues, and has to be surgically removed. Also, due to rapid weight loss, there can be complications with gallbladder and people needing gallbladder surgery. There can be some issues with the ability to eat. Depending on how the surgery went, you're going to be restricted. You have to eat less. But sometimes if people overeat, they're going to vomit, or they may get really sick, or they may have diarrhea, or if they eat things that are too concentrated with sugar or carbohydrate, they may not feel very well. So those are cons. Most people know that these individuals are going to have some absorption issues with the vitamins because of how the stomach and intestines have been rerouted. We're changing that normal engineering, and one of the results of that is that they do not absorb certain vitamins and minerals as well. That is typically supplemented with bariatric vitamins, but if people don't take them, or if there's some other reason why, even if they're taking them, they're not absorbed, then they can have some vitamin deficiencies, and some of those can be very serious. If it's iron, for example, can cause some major issues, so that can be a con. The second part of the question that I was asked is, do I recommend bariatric surgery? 100%. I am on the spectrum with my colleagues in bariatric surgery for weight loss. We ultimately want people to prevent chronic diseases related to excess body fat, and we want people to have a good quality of life. So I absolutely refer people to bariatric surgery, and I believe it is a great resource or tool for people who need it. There are some criteria for bariatric surgery. You do in this country have to have a BMI over 40. Or you have to have a BMI over 35, and you have to have at least 1 or 2, I think typically now the criteria is 2 weight-related issues. So that can be my knees hurt, I have osteoarthritis, it can be I have sleep apnea, but anything that has been associated with weight can count for that. And then insurances have different criteria as well. Some insurance plans will require that you see someone like me for 3 to 6 months before being able to do surgery, just to know that you're serious and you're learning. Some insurances are gonna require that you see a dietitian or that you see a psychologist and different things. So based on the insurance, there may be additional criteria, but that's gonna vary based on the insurance. And there are some age requirements as well. I do not know what the minimum age is right now, but last I checked, I think it's 17. That may have changed since I don't do this every day. But 17-year-olds can get bariatric surgery. And who else should get bariatric surgery? People whose lives are in dire need of this type of intervention because they're at risk of dying. So I definitely promote bariatric surgery along with medical weight loss as well. Medical weight loss is a wraparound program. I see people before and after bariatric surgery. So again, we are on the continuum. So I hope that answered the question, and thank you so much for the individual who sent that question. And for those of you who are thinking about bariatric surgery, talk to a bariatric surgeon in your area, do a consultation. A lot of hospitals and programs have free videos, they have free resources and tools, they have visits that you can do to kind of ask questions. They may even have support groups. Talk to your primary care doctor, and also find a medical weight loss specialist like me and talk to them as well, because they can at least get you started in the process with nutrition and also losing some weight before you even do the surgery. I hope that this is helpful, and I will see you next time. Make sure that you check us out online and also on our social media, www.abundanthealthvitality.com, and then at Abundant Health Vitality for our Instagram and Facebook. See ya.